High-quality colonoscopy, using textbook process as a composite quality measure. Introduction. High quality is at the core of healthcare provision. Clinical audit can be a valuable tool in healthcare to improve the performance of an individual doctor, department, or hospital, thereby contributing to improvement in the quality of care. For colonoscopy, such quality measures exist and have shown their benefits in relation to patients' risks of post-colonoscopy colorectal cancer, PCCRC. For example, the adenoma detection rate, ADR, has been found to be inversely associated with the occurrence of PCCRC. Audit and feedback on colonoscopy quality measures resulted in improved performance of these measures. Data on single quality indicators do not, however, reflect the complete process of a colonoscopy and may not reliably measure the overall quality of this procedure. Composite measures combine several aspects of quality for specific procedures, resulting in an all or none measurement. Such composite measures may provide a better and potentially more stable reflection of overall quality, as opposed to a single outcome indicator. Moreover, all or none measurements may be more suitable for quality monitoring, owing to their being a more sensitive reflection of performance. All or none performance measures have been successfully introduced for the ideal outcome of surgery and have been termed textbook outcome. This has been defined for several surgical procedures. For example, textbook outcome for pancreatic surgery includes the absence of postoperative pancreatic fistulas, bile leak, post-pancreatectomy hemorrhage, severe adverse events, readmission, and in-hospital mortality. Textbook outcome has been demonstrated to be a feasible and useful parameter in the surgical field for comparison of performance between hospitals. The result of an all or none measurement may provide a better indication of overall quality and provide a better opportunity for quality improvement when compared with data on a single quality indicator. With single quality indicators, compliance of greater than 90% is often achieved, leading to limited space for further improvement, which could temper the motivation for changes in clinical practice. If there is more room for improvement, this will more likely lead to quality improvement initiatives. In this study, the authors aimed to investigate an all or none measure for colonoscopy. The authors used a modified Delphi consensus process to propose a definition for the optimal process of colonoscopy, the textbook process, TP. TP includes multiple components that, when all achieved, could represent the ideal process for colonoscopy. All of the included components should be accessible per colonoscopy. After defining TP, the authors assessed the achievement of TP in 2 endoscopy services and measured the variation between endoscopists. The ADR is regarded as the most important contemporaneous measure of colonoscopy quality, but it is not assessed at an individual colonoscopy level. Given the established importance of the ADR as a quality marker, the authors evaluated the potential additive value of TP by assessing the correlation between the achievement of TP and the ADR. Background. High-quality colonoscopy is fundamental to good patient outcomes. Textbook outcome, TP, has proven to be feasible multidimensional measure for quality assurance between surgical centers. In this study, the authors sought to establish the TP as a new composite measure for the optimal colonoscopy process and assessed how frequently TP was attained in clinical practice and the variation in TP between endoscopists. Methods. To reach consensus on the definition of TP, international expert endoscopists completed a modified Delphi consensus process. The achievement of TP was then applied to clinical practice. Prospectively collected data in 2 endoscopy services were retrospectively evaluated. Data on colonoscopies performed for symptoms or surveillance between January 1, 2018 and August 1, 2021 were analyzed. Results. The Delphi consensus process was completed by 20 of 27 invited experts, 74.1%. TP was defined as a colonoscopy fulfilling the following items: explicit colonoscopy indication, successful cecal intubation, adequate bowel preparation, adequate withdrawal time, acceptable patient comfort score, provision of post-polypectomy surveillance recommendations in line with guidelines, and the absence of the use of reversal agents, early adverse events, readmission, and mortality. In the 2 endoscopy services studied, TP was achieved in 5,962 of 8,227 colonoscopies, 72.5%. Of 48 endoscopists performing colonoscopy, attainment of TP varied significantly, ranging per endoscopist from 41.0% to 89.1%. Conclusion. This study proposes a new composite measure for colonoscopy, namely textbook process. TP gives a comprehensive summary of performance and demonstrates significant variation between endoscopists, illustrating the potential benefit of TP as a measure in future quality assessment programs.